uh, around like almost like 10-15% of the American population had hearing loss, and we had around 20 million population when President Clinton was there. And now with the current president at this time in 2023, now we have nearly 40 million people of hearing loss over 10 years. 40 million, that's a lot. So no other than Dr. Chadrashekar can speak more about this. It's my privilege to introduce Dr. Chadrashekar. Dr. Chadrashekar.
Okay, thank you, Dr. Pramod and Dr. Shashidhar. I don't know whether I deserve that much of introduction, but Dr. Pramod, appreciate you giving us an opportunity to bring more awareness about hearing loss, and that's a privilege. Thank you for doing it. And as we were discussing, it's one of the, I think that hearing loss is the third largest medical condition, which especially in the elderly population right now. And I know there are several medical professionals in this call, but also just for the benefit of everybody, I'm just going to start with little basics, and then we'll move on to mainly the relationship between hearing loss and dementia, which is more proven that an untreated hearing loss can increase the chances of severity of dementia. So we'll just go through some of the slides and discuss and share some the research evidences which is coming up right now, and what options we have as a community, and let me see if I can share my whiteboard. And okay. Can you see my whiteboard? And I'm trying to share a slide.
Cannot yet see right now. Are you clicking on the share?
Yeah. Let me see if I can.
Yes, I can see.
I'm trying to see if I can make it maximize it a little bit more.
Yeah, maybe make it 100%. So.
Yeah. Is it better now?
This
I zoomed it to 300%.
it's still as.
Oh,
Can I go ahead and project the slide from my?
Yes, please. Yes, Dr. Pramod, please do it. Yeah.
Then you stop sharing.
Okay.
You stop sharing. There is a thing about. And this. Can you stop sharing your slide?
Yeah. Okay. Dr. Pramod, you can do it, sir. Thank you.
Okay. Can you see now? Can you all see the slides?
No.
Not yet.
One second.
It's loading.
Yeah, it's loading now, Dr. Pramod.
Okay. Now.
Perfect. Yep.
Yeah.
Thank you, sir.
Okay.
Awesome. So, hearing loss and dementia, that's the main focus of today's talk. And hearing loss can be a sudden or a gradual change in how well we all hear. People with hearing loss may notice difficulties with everyday conversation, especially in the presence of background noise, or if they're in a complex environment where multiple people are talking. And dementia is a general term for a group of symptoms that impact abilities to think, remember, and reason through the activities of daily living. I just wanted to give a brief definition of that or a understanding of. And next slide, sir. This is the just brief anatomy of the ear, how our ears perceive. When we say hearing, basically there are two components. One is the ear, which receives the signals, but the understanding happens in the brain. So as we can see in this basic anatomy, when we hear the sounds, so basically it goes from the external ear, the outer ear, or the ear canals, which vibrates the eardrums, and that in turn vibrates the three small bones, which transmit the signal basically to the inner ear, which is the main transducer, or which is the main processing, which converts basically the sounds what we hear into electrical impulses, which goes through the auditory nerve. Basically, simple, basically this is the sound coming here, converted into vibrations, and that vibrations are transmitted to the inner ear, and from the inner ear, it's transmitted to the auditory nerve. And in the next slide, that auditory nerve, basically we just drawn a path how it goes from the ear all the way to the brain. So mainly the understanding is happening in the brain. So, but the signal is processed all the way, through this. Next slide, sir. Okay. It's basically, different parts of the, okay. So, what are the risks for somebody to developing a hearing loss? Generally, the hearing loss, some hearing loss conditions have a significant familial history, genetic origin. And, but for rest of the people, other main causes is the ear infection, earache, ear pressure, fullness, and eustachian tube dysfunction. It's basically a lot of time, when we fly, we experience, our ears being blocked, and so that's what we call by eustachian tube dysfunction. That's one of the symptoms. So, but the persistence of any of these can lead to hearing loss, and basically all this, the second condition, especially, all of them can be medically treated, and a lot of time that hearing loss is reversible. So if any of these symptoms, basically they can be medically treated. So, and the other thing is the tinnitus or ringing in the ear, which is also very common, and dizziness, history of vertigo, imbalance, because the hearing organs and the balance organs in the inner ear, they are together. So the symptoms of dizziness, vertigo, and imbalance can also, be one of the risk factors for developing hearing loss. Exposure to loud noise, music, and iPods, and especially, with the increase in the technology, people are using the earphones and earbuds and all kind of that. Any loud exposures over a long period of time can cause an irreversible damage. That's the main challenge with the noise, is any hearing loss caused due to the noise exposure. Again, this is preventable, but once the damage has happened, like Dr. Pramod we were discussing before, it's a permanent damage. So that is something which, we should be educating ourselves and our families about the consequences of that. And then there are other medical conditions like diabetes, hypertension, autoimmune disorders. Those things can increase the risk of developing hearing losses. Now, a lot of time, this is ringing in the ear is a very common, symptoms. A lot of people, and it can result from various reasons. It could be as simple as having a wax in the ear. If the ear canals are plugged up with wax, people can start hearing the ringing. can be as simple as that to as complicated as having a tumor. So bottom line is basically the point I would want to drive is when you start noticing a persistent ringing in the ears, please do not ignore it. Get a medical opinion, consult your doctors and consult and get your hearing checked with a qualified audiologist. Because as I said, it can be a simple problem like a wax or the ear infections, middle ear conditions, or damage to the inner ear, and it can be sometime as serious as a tumor in the auditory nerve. And also the other thing is, there are certain medications which can result in ringing in the ear. Again, if on a consistent basis, if somebody is taking these medications, it's a good idea if they notice the ringing has increased or gotten worsened after they started a particular medication or after they've been on some medication. Please discuss that with your primary care, the medical providers. Basically a lot of time, again, that is some things the doctors can look at medications, which can have a less side effect. So basically, any of these conditions, as one simple recommendation is please do not ignore it. If it is persistent, get a medical opinion, get to an audiologist, get yourself checked so that it can be identified, because the ringing in the ear can be an earlier sign of a damage to the ears. So that's the the point, the take home point is please, earlier stages, and especially if you start noticing in 1 year and only, that also is a significant thing. So if you just start noticing the ringing in 1 year, please do not ignore it. Next slide, sir. Now, there are some of these things are very common precautions which we can take to prevent the hearing losses, and especially the hearing loss when the damage happens to the inner ear. Unfortunately, right now it's not reversible. There's no transplants, there's no operations, nothing can be done to bring back the hearing loss, which is results from damage to the inner ear. So, and one of the most common things which we can avoid, as we discussed before, is the noise precautions. The noise is, again, a lot of time we think that when the noise exposure is like, if somebody is firing weapons, or they're working construction workers and all that. But even the day-to-day noise, lawn mowers, power tools, recreational noises can be damaging, if they're exposed over a period of time. So the good idea will be to, protect our hearing when we're using any power tools, chainsaws, lawn mowers, any of those things. And other thing, which I just wanted to caution about, recently there's been a lot of advertisements about over-the-counter hearing aids, so just be careful. Some of the over-the-counter hearing aids, if they're not selected properly, because they're not selected by a qualified professionals, it can lead to over-amplification. That means you may get more sound than you get. That can be a source of noise exposure. So we'll talk about that a little bit later, a little bit in more details. And other common thing which a lot of us can avoid is using the Q-tips. And I'm sure Dr. Uma can urge for that. And also there'll be, it can cause, a damage to the, the ears, which we can prevent it. There are other ways to manage the wax. So, and other thing also is basically, do not neglect the nasal allergies, ear infections. And the one other thing is vertigo or sudden hearing loss. If you wake up and you start noticing there is a change in your hearing, please, there is a limited time where if you get a proper medical treatment, some of those hearing loss can be reversed. So please pay attention to that. If there is a sudden hearing loss, so don't judge yourself or don't treat yourself. Please get to the doctors. And if you're able to get to the ear, nose, throat doctor or an audiologist, do that, or at least get to the primary care doctor. As I said, the timing becomes very important in sudden hearing loss. And regular taking of antioxidants, can be beneficial. It's been more and more studies now, coming up, saying, use of antioxidants is helping in preventing the onset of hearing losses or delaying, it can delay the onset of hearing loss. And in certain conditions, basically, reducing salt and caffeine can be beneficial, especially if the hearing loss is along with the dizziness. And, let's go to the topic today is what we're talking about, hearing loss and dementia. So what do we know? And this has been a hot topic, as Dr. Dar was saying. With all the research, what we know is dementia is more common among people with untreated hearing loss. The key is untreated hearing loss. People with untreated hearing loss tend to develop more cognitive decline earlier than their peers with normal hearing. Again, that's a significant finding also, and which has been proven there. And people with untreated hearing loss report more concern about their memory than people with normal hearing. I think if we understand these three things today, basically the rest of the slides, I'll go through, saying why it happens. But these are the three things, basically, untreated hearing loss and dementia has a significant correlation. Next slide, sir. Now, basically, this talks about simple, and these are all from the major institutions like Johns Hopkins, National Institute of Aging, and all that. So basically, what this is trying to tell us is the risk of developing the dementia in untreated patients are much higher. If you look at this last point here, hearing loss is estimated to account for 8% of dementia cases. Now, which means, almost 800,000 people are nearly, basically in the new cases of dementia, are related, the hearing loss may be responsible for that. So that's a big number. As Dr. Dar was saying, the number of people with hearing loss is increasing, and the same thing with happening with the dementia patients. As our population is aging, that numbers are also growing. Next slide, sir.
I think that's the last slide.
Oh, that's the last one? I'm sorry. Uh-oh.
That's
Okay, let me go back. Okay, I thought I shared the, okay, let me go back to my whiteboard and see if I can share more of my slides.
Go to the previous slide.
No, so let me go back to, because I think we had more slides. Let me see if I can share mine. I did send a recent email, Dr. Pramod, to you and Dr. Dar recently. Let me see if I can.
I think that's a recent part.
Oh, that's a recent one? Okay, let me go back.
That's for the picture of the anatomy.
Okay. Yeah, no, okay, I'll do it. So let me see if I can open it here on my side.
You're seeing a whiteboard.
Using just the whiteboard, not the slide.
We can see the slide.
You can see the slides, okay. Not this one. I'm trying to slide onto the next slide.
Dr. Chandrashekar,
Yeah.
Instead of whiteboard, can you just share your screen and play slides?
Okay, let's see if I can do that. Sorry, I'm getting my technical assistant here. My wife, Padma.
You can, if you go to the share
Screen.
screen, the green button down. Yeah, we can see that. It's okay. You can, okay, you can see that.
Go to the next one.
Okay.
Perfect. I got it. Thank you. Okay. So then the next, I think we were here. Let's see. Okay, we were here. Okay. So ways a hearing loss may lead to dementia. Now, this just basically summarizes why the hearing loss, untreated hearing loss, can lead to dementia. So when we don't treat hearing loss, and when somebody is trying to compensate, a lot of time, that's one of the common things people say, oh, one-on-one, I can hear you okay, I don't need hearing aids. And also what happens when there is a familiar environment in the families and all that, we know the speakers, we know the context. Even if we don't understand everything, we can make up what the other people are saying. But moment there is a background noise or there's a new conversation or somebody else you're not familiar, start talking, then we start using more energy to understand them. So the constant effort to hear may stress the brain to the point that less energy is given to the functions such as memory. So because when we are straining our brain to understand the conversations, so the resources given for the memory, that gets reduced. And also, when we don't hear well, the part of the brain which is responsible for hearing, it does not get stimulated. So that may start shrinking. And being hard of hearing often leads to social isolation. This is again one of the biggest point which I wanted to drive, which is a risk factor for cognitive decline and depression. Another, because a lot of time what happens, I can say that with my own father, when he does not hear, when he does not wear his hearing aids, the conversation happens in less than 2 minutes because he gets frustrated, he doesn't want to talk to people. And we have to constantly encourage him to use the hearing aids. And so in that way, he can participate. And also the other thing is the ongoing research points to the possible common physiological pathways, like the things which can cause dementia and also the hearing loss, the root cause can be the same. Basically one of the causes could be, like an example is the high blood pressure. So which could be causing both hearing loss and dementia. Now, what are the early signs of hearing loss? These are some of the common signs, which especially, if we notice one of our family members or we ourselves are having, it's time for us to get our ears checked, by a qualified audiologist or, medical professionals. So basically difficulty understanding speech in a noisy environment like restaurants, malls, cars, when there is more, that means, and feeling like people mumble or speech is unclear. Saying things like, I can hear, but I cannot understand. Family and friends often need to repeat themselves for us. Difficulty understanding someone if you're not looking at them. Again, as I said, a lot of time, in the family, we don't recognize the hearing loss at early stages because we are in the familiar environments. Your family says you keep your TV or radio too loud, increase frustration during conversations, avoiding social situations because it's hard to hear. Now, also the early signs of dementia. So again, this is basically from the Mind Center, they listed, okay? Forgetfulness, especially for the recently learned information, difficulty performing tasks that are familiar. So like preparing a meal, placing a phone calls, playing games, they have been doing it for a long time. They find it difficult to do that. Problem with language, increased difficulty in recalling words, disorientation to the time and place, getting lost in the familiar area. Again, the key point is familiar area. Poor and decreased judgment, inappropriate clothing choices, financial decisions, problem with complex mental tasks, losing things and misplacing them into unusual places, changes in mood or behavior, changes in personality, or loss of initiative, becoming more passive.
Zoom is going on right now.
There's a chat. No.
But the Zoom is going on right now. That's the one.
Now, the important question is, can hearing aids reduce the risk of dementia? Properly fit hearing aids are known to reduce listening effort, allowing more brain resources to be available for other activities. Hearing loss can also re-stimulate the areas of the brain that have been neglected due to hearing loss. Lastly, the hearing aids are known to improve social communication, which may prevent or delay the onset of dementia. So the key point is basically if someone suspects they have hearing loss, it is recommended that they have a hearing evaluation and discuss treatment options with an audiologist. Any questions before I move forward?
There are two ways to answer the questions. One is you can put in the chat line, and I think there are two questions in the chat line. Let's answer those, and then
Okay.
we'll open for the audio session.
Let me see if I can get to the chat, sir.
I think that was just a direct message. There's not a question. That's okay. Let me, can you stop sharing and let's get the whole screen up?
I got a few more slides, Dr. Pramod. You want me to finish
Okay,
the
go
slides?
ahead.
Yeah,
Go ahead.
Okay. So, and this is the other thing, friends, basically just the topic I wanted to highlight again. Recently, the FDA has approved over-the-counter hearing aids, but a couple of, one way I'm glad, it's available like reading glasses, but I just also want to, be cautious about what it can do and I don't want it to be misrepresented as saying that, this is a hearing aid, because it is something similar to like a reading glasses, basically it's not a prescription. It is, so just an amplification device. So, but when you're getting the over-the-counter hearing aid, there are certain risks associated with that. Basically, if there is any underlying medical conditions that can get missed because the person who is prescribing is not qualified to do the hearing evaluations or to assess the medical conditions or make the proper referrals. And basically, I would just go to the last point, which I highlighted here, with any self-selected devices, there is a risk that the technology will not give you the volume or the sound quality you want and need it. And also, sometimes it can lead to over-amplification. That means more sound than what you really need. So it's always the best recommendation is to get your hearing tested from a qualified audiologist, or at least consult your medical providers and be judicious about your resources. And basically, I've thrown some, references if somebody wants to go back and read a little bit more onto those articles. And let me see if I missed any other slide in the transitioning. I think Dr. Pramod, we covered it, sir. Thank you.
Okay, let's stop sharing and we'll open.
Yes, sir. I will stop sharing and basically.
Okay, now, as I said, there are two ways to ask the questions, and we want more questions, and we want personal experiences, and we want to share that. There's nothing stigma about hearing loss. So the more we share with our colleagues and friends, they will get more effective treatment and proper hearing aid. So they're all muted right now. If you have a question, please unmute yourself, or if you would prefer to type it in the chat line, you can type that in the chat line. So let's open it up for any questions. Okay, while people are thinking about it, let me tell you my personal story. I'm 85 years old, and I started having hearing problem about 4 or 5 years ago, maybe 6 years ago. And at one-to-one basis, or there are 3 or 4 friends, I was fine, I could hear. But larger crowd, it was very difficult. And many times you kind of nod as if you're hearing, and you don't hear half the conversation. And then you kind of get a little disheartened, and yeah, I'm not hearing properly. So gradually, of course, I went to the audiologist 6-7 years ago. Then I had one hearing aid 5 years ago, which was a little old-fashioned. So recently, just I've been seeing Dr. Chadrashekar, who is in the audience here, and he recommended this hearing aid. He examined me properly, and I was very impressed the way he was selecting my hearing aid. And he recommended this phone, PHON. I'm very happy. I'm kind of getting adjusted. I'm doing some adjustment on my phone. And so, needless to say, I'm happy now. Other thing is, a lot of people, and including myself, have problem hearing on the television. I start use sometimes the headphones available on television. It helps some, but not that clarity. So I think I'll stop here, and I think Ulas Gokte has a question. Ulas.
Yeah, is there any oral medicine to take to improve the hearing aid? Ayurvedic or
I know in the panel, we do have some ENT doctors, but the answer, is no, sir. Unfortunately, there's no medicine which can reverse the hearing loss, which happens over a period of time. But as I said, if there's a sudden onset of hearing loss, like somebody wakes up in the morning and suddenly they start noticing there is a change, that condition, please, as I said, get to the medical doctors, and they can give some steroids, and they can treat. That's one condition which can be reversed. The hearing can be brought back if somebody has a sudden hearing loss, but the timing is very important for the treatment, the diagnosis and treatment. Again, I would not recommend, it to be get yourself checked with the places like Sam's Club, Costco's and all that, because they don't have qualified audiologists doing it. And also it need to be, treated with a medical provider. And the other thing, what they're noticing is taking a regular antioxidants can minimize, reduce the, can delay the onset of hearing loss. There is some research on that, but there's no oral medication which can suddenly bring the hearing loss back.
I agree with you 100%. This is Uma here. There are no medications as such, but when they have the tinnitus, actually, by the way, it's a very comprehensive presentation because you have covered the main issue of onset of dementia, as the hearing loss being a precursor of situation like that, which can be avoided. But I agree with you that there are no medications that we know of at present that will prevent the hearing loss, but we can cut down on you already mentioned about the caffeine and aspirin and stuff like that, which can reduce the tinnitus, but not the hearing loss as such. And the other most valid point that you touched is something that someone called me recently. A 40-year-old young lady with a sudden hearing loss, when they went to a hair salon, I was very surprised. I said, is there a sudden change of your posture, or is there a trauma or anything? But apparently they tilted the neck very suddenly, and then she developed severe dizziness and tinnitus and hearing loss. And her audiogram showed 75 to 80 dB loss, which is unfortunate. But there are a few instances where within a week, if you start the steroids, they may get better, but I don't think I would promise anybody that. So that's my two cents.
To mention that Dr. Uma Yuneni, who just explained a lot of things. He's an ENT surgeon, practiced in Jacksonville for nearly 25, 30 years. He has come to Nashville as retired now. He has been a great asset. And that was a great explanation you gave, Uma. Thanks.
Oh, I have a question, Pramod. Lalit, can you hear me?
Yeah, I can.
I have a couple of questions. At night time, I have a headphone and I listen to news, which comes on iPad. And almost is an hour. There is a lady who presents news, comes on Vintage. And every night I listen to that for an hour on headphones, with using headphones rather. Would that cause any harm? My wife says this is not good. It's going to cause problem, going to cause brain tumor. He said there are reports like that. That's one question. Second question, I have a lot of my friends, they use this hearing aids and they have such amount of complaints, even with hearing aid when they are sitting in a group of people. And when you try to talk to them, if other people are talking, they have a tough time. They just cannot understand what you're saying. So he says, please, there's so many people talking. I cannot understand. So, and a lot of them have bought expensive hearing aids and this just doesn't work. So is there a particular brand of hearing aid? Third, my hearing loss is about, I would say 15-20%. I don't have that bad. I'm afraid of getting hearing aid. I said, is it worth it to, get a hearing aid? And right now I feel I'm okay. So these are the questions. And my primary care told me, so, oh, Dr. Shah, hearing loss can cause dementia and all that. I say, I understand that, but you have to look at individual cases. So if you can, answer those questions, I would appreciate that.
By the way, Dr. Lalit Shah is my classmate from medical school. We graduated in 1962.
Oh, Pramod, don't
Classes.
give away all our secrets. Oh my God, you have to know Pramod and me. Pramod taught me how to read and how to do anatomy. That's how I went through my medical school. I can never forget that. Anyways, go ahead, please.
Answering the first question about using your headphones for 1 hour, if you are looking at it from a noise exposure, there is a trade-off. One, how loud are you listening to? 1 hour, you already set the time, because there is a inverse proportion of the loudness of the noise and the duration somebody can be exposed to. So, that's one thing. And again, is that going to the headphones causing tumor and all that? That's, it's one of the, I think, possible, probable, causes which is not proven. So at this point, it's deemed to be safe at this. It's like recently there was a article about asparaginase and cancer. Like how the recommendations are made. So basically, anything excess with the hearing law, can loud noise exposure for over a period of time, that can cause hearing loss. That's a known factor. As far as the hearing aids and your friends complaining about it, there are a couple of things. One, what happens, again, not knowing all the details, Dr. Dar can chime in, because he does a lot of dispensing. The practice where I practice is basically we educate people on one, what we call as adaptation to the hearing aids, and there's an acclimatization period, and also the need for follow-up appointments. A lot of time people get the hearing aids and they're not, like Dr. Pramod was mentioning, basically he's happy, but there are still situations where he'd like to go back to Dr. Dharan for fine tuning. And that's going to be the trade-off. And then also what happens, understanding in complex listening environments, the hearing aids have come a long way. The technology has come, very, from where it was to where today. there's a big difference in the technology, but still the understanding happens in the brain. And so the hearing aids what they can help us is to increase the signal to noise ratio. So it can make the signals more purer, more better. And but then if there is still problems, if they have a high-end hearing aid, if they still continue to have a problem, there are different accessories which we can look into to help them understand conversations in a difficult environments. And as far as the hearing aids, you said you have a mild hearing loss, and will the hearing aids work for you? Dr. Shah, I think one of the good things will be to get a hearing aid on a trial basis, because what happens a lot of time, that's what happens when people have mild to moderate hearing loss, they are able to manage without hearing aids. But once they try a hearing aids on a trial basis, because all the hearing aids can be purchased or even dispensed based on a trial basis. So that, you will be the better judge at that time, basically how much it's helping you or it's not helping you. I think
Can you
those are the three questions.
can you return the hearing aids if one is not appropriate for him?
Each practice has a guidelines, because unfortunately I cannot speak much from the private sector, because I'm spoiled, in a government sector we do have much better trial periods and all that, but Dr. Dar may be able to give a little bit insight on that.
Yeah, thank you, Dr. Chandrashekar and Dr. Pramod. Yeah, talking about Dr. Lalit's question, initially the headphone, actually you're doing the right thing. Wearing a headphone and listening to the audio that's what I encourage. As an audiologist, I'm the last person to recommend a hearing aid. I recommend a hearing aid only if it is needed. I mean, that's the right practice. There are people who just, you go to Costco or Sam's Club and you come out with a hearing aid. I even had a doctor, a physician, he was fitted with $3,000 hearing aid and he was sent home for a 25 to 30 decibels of hearing loss, which is unacceptable for me. So I do recommend, initially what I do is in my practice, I do recommend certain assistive listening devices. I do encourage, including me, if, for example, I get a phone call, I want to listen to a YouTube, I am more comfortable to put on my Bose headset, and I'm more comfortable to listen to that. That's fine, but keep the volume low. Keep it at a comfortable level, not at a very high level. Speaking about the processor, like a hearing aid, there are varieties of hearing aid. I do recommend about at least 8 to 10 different models of hearing aid, but overall, I just stick on to about 3 to 4 top companies, because the return period is around usually about 30 days trial period. The patient can return the hearing aid if they don't hear properly or if they're not happy. And the hearing aid manufacturers do accept it back. It's very, it's very expensive, $3,000 to $4,000. I do agree, but it involves a lot of AI technology involved in that. And it also depends on the audiologist who does use the software to fit the hearing aid based on the graph. That's why the graph is very important. Using the technology, the software to fit the hearing aid. For example, Dr. Pramod just now told he had a different hearing aid fitted by a technician before. Unfortunately, that was not adjusted to his graph hearing loss. So when he came to me, I did a detailed analysis and I used my software to fit. It's a different brand, but the processor involved, all you do is, the hearing aid is nothing but a computer. You're wearing a computer on your ear. That's what I tell patients. And you need to program that computer. And go for a long time. Usually it should last 4 to 5 years. Most hearing aid, good quality hearing aid, last about is about 3 to 4 years, and they come with 3 years warranty. Some patient want always, oh, I have insurance benefit. I want to go through insurance. Okay, there are some insurances they do give hearing aid. They mail the hearing aid to us, and my audiologist hands are tied up. I don't have any freedom. I have to, even though I recommend a different model, they want us to fit their own hearing aid because some of the insurance company own hearing aid companies. So they want to fit their hearing aid. You know, it's a question of business. I can't speak about insurance company. I'm not a good candidate for that. I can, as audiologist, my job, as Dr. Chadrashekar said, this is what I tell patients. I fit technology to the patient's ear. I don't sell hearing aids. So this is what I've been educating patients. I do encourage all the, like even seniors to use regular headphone, including the bone conduction headphone to listen to the music, or it doesn't matter. Just keep the volume low. You hear much better. You may not even need a hearing aid. So, but make sure that your patients who have diabetes, hypertension, they need to be tested at least every year. I would encourage annual, like a vision check, hearing check. Make sure that even though if it is, you may not change anything, but I would encourage you to go to the audiologist, get your ears clean, or your primary physician. At least they can do some screening. If audiologists cannot handle, if they need a surgery, we always refer to an ENT who takes care of surgery. Yeah, Dr. Chandrashekar.
No, but you didn't give the names of the
I
company
think-
to recommend. What are the names of the company?
There are, as I said, I should not be biased as an audiologist. You may ask me, there are different models, different manufacturers that includes Phonak, Unitron, Resound, Signia, you name it. There are good quality hearing aid. And Dr. Pramod has, I think, is that Phonak, Adio, I think advanced. See, this is what I would like to encourage patients. There are premium quality, there are advanced, and there are standard one. And there are entry-level hearing aid. So just an entry-level hearing aid, like over-the-counter hearing aid, may not satisfy their audiogram. They may be varying, but they may not understand what is exactly. It has to be programmed. As I said, it should be a tailor-made. So we have to use Nova software. It's a special software to program the hearing aid to your needs. Yeah.
I think Mr. Gopte has some question. Mr. Gopte.
Operation, how successful rate is there? Successful rate of operation?
Dr. Chandrashekar, you want to say something?
No, Dr. Uma is there, so she can take that question because she's the expert on that, operations.
Uma is still there? She must have just.
I think, yeah, yeah. Sir, I think she said she's going to be traveling. She's going to be on the phone. But Mr. Gotke, basically it depends on what kind of surgery you are talking, sir. Basically that's a good question for your ENT surgeon who's going to be performing the surgery. They can explain, because without knowing what kind of surgery you are referring to, it's kind of hard to answer, but I would encourage you to, get yourself tested before the surgery and also get a proper estimate of the percentage of recovery risks and benefits of surgeries, and also the post-operative, evaluations. So please have that discussion with your surgeon and the audiologist.
Yeah, 2-3 of my friends, they say the surgery wasn't never successful. So I wanted to ask this question to expert like you.
Sir, are you referring to the cochlear implant surgery? Like, in people, when they have profound hearing loss, where the hearing aids are no longer beneficial to them, there is a surgery called cochlear implant. And if you are referring to that, the cochlear implant surgeries have been, again, like any technology, any surgery, they come a long way. The success rates have been significantly higher with the cochlear implant surgery. But again, I just want to make everybody understand, just having a cochlear implant surgery will not return your hearing back, because the brain needs to be trained. What happens in cochlear implant surgery is your brain is stimulated electrically, where the sound, whatever you hear the sound, it's converted into small pulses, electrical pulses, and that stimulates the nerve. So it's not, in the beginning, it does not sound like sound. It needs some time for the brain to process and understand. So after the surgery, there will be what we call as a rehabilitation period, where they had to go for training, 3 to 6 months, basically, for the brain to understand. So they get the signal, but the brain needs time to adapt to that signal, because it does not sound like a sound like what it happens with hearing aids, if you're referring to that surgery.
That is the kind of surgery that they put chip inside your skin?
Yes, sir. They go behind the ears, and they put a transducer, yes, you are referring to the cochlear implant surgery. Yeah. But again, that is something people need to be aware of it. Right after surgery, there will be an adaptation period of 3 to 6 months. And also it depends on their other medical conditions, like their cognitive skills, and their lifestyle and all that kind of stuff.
I think
Speaking about, in addition to the surgery he was talking, like I think mostly Mr. Ullas was talking about cochlear implant, as you said. Cochlear implant usually done in Nashville, if you take, the St. Thomas, they do, Dr. Schwaber, ENT, Nashville ENT, they do, Vanderbilt does it. So it all depends on which candidate is, they also consider any underlying condition, health problem, the, diabetes, hypertension, and their hearing loss. So they don't do cochlear implant surgery if the hearing loss is below 60 decibels. It has to be minimum 60 decibels. So that is the main criteria. And also, if you are referring to, middle ear surgery, the problem with the eardrum or bones, if you ask my honest opinion, after 50, 60, I would stay away from those risky surgery, because when the surgeon do any surgery in the middle ear, there is a facial nerve that goes to the middle ear, and accidents can happen. It can cause Bell's palsy for elderly people. So I would just suggest, between patient and the family, and to weigh the pros and cons, how much cost and benefit involved in that, for those kind of middle ear surgery. If it is a fluid in the ear, and if a ENT surgeon is putting a tube in the ear, yeah, that's possible. So it all depends on what kind of surgery you're talking.
Okay.
Excuse me, I think Inam has been raising her hand for a long time.
Thank you,
Sorry,
Dr.
Inam.
Vasudev, for organizing this seminar. And thank you, Dr. Chandrashekar and Dr. Dhar. You all have, a lot of my questions have been already answered in this conversation. But I'm 63 and I have been diagnosed with profound hearing loss. My condition is very, very different. I have been I have been with only 1 ear since my childhood. I was 3 or 4 years old when I had a damage to one of my ear due to fall. And they did fix the problem back then, but they didn't probably check the hearing capacity at that time. And when I grew up, went to the ENT and they said, nothing can be done with this ear. It's totally dead. So, but I have lived my life perfectly fine. When I came to United States, I was told about middle ear surgery, cochlear implant. And even then they said, it's not 100% sure that I would have any restored hearing in this ear. So this is about maybe 30 years back. So I gave up. Only my family knew up until now that everybody has to walk on my right side, or if I have to sit, because I don't hear from right side. So they have to be, if I walk with my husband, I walk, he has to be on my left side. So when we are walking and we are hearing, so nobody ever knew, but I teach. In the past 2-3 years, I have found that I have to ask the students, can you please repeat your question? Can you please repeat your question? I'm having difficulties. So I was having problems with bronchitis, and when I went to ENT, he wanted to check my hearing, and his result was profound hearing loss. And so I had my second visit, and I was listening, I was watching this, observing this seminar coming up, and I was waiting. So he also has referred to me about if I want to get the cochlear implant surgery for my right ear, so my right ear can. And so I discussed with my family, I don't want to go for any surgery. However, I want to go ahead and get the hearing aid. So Dr. Dhar, just a question to you. I'm currently in Dallas, but I'm coming back to Nashville. Should I make an appointment with you?
Yeah, just email or you can go online, audiologyconsultant.net. Speaking your, that's a, this is what I see day by day. This is what I see. Very common for me, sudden hearing loss, or with after COVID, sudden hearing loss has already increased due to the virus. It has affected the inner ear. And especially if it happens to 40, 50-year-old people, very young, and then, if they neglect it, that's a risk of, as Dr. Chadrashekar said, that's a risk of getting into dementia in future.
Yes.
So yeah, it is better to, there are varieties of hearing aid models available for your kind of hearing loss. It's called cross hearing aid, CROS, cross. Like that means the microphone on one side, the hearing aid on the other side, or bi-cross hearing aid. So you won't have that directional problem. I do understand that's a direction problem. If one ear is better than the other ear, so it's confusion, which side is sound is coming, if a walking, if a bicycle person, he can come and hit you, That's it. I mean, this is very common.
Yes.
I do encourage, try this. Keep your cell phone under the pillow and listen to the music. You will see a big difference.
Yes, I do. I mean, like I said, in my case, like when I wear my headphone, I don't even need the headphone here because I don't listen even 1%. And this has been done in the audiology test when they did it in the ENT doctor's office.
Yeah,
so
but please bring your graph or anything that you have, and email ahead of time so we can compare the graph, what you have, and discuss about the current technology hearing aid. As I said, after 50, 60, I am not a advocate of surgery or I would play safe, but it is between family and patient and the surgeon.
Yes, I have already discussed with my family, and both my daughters, they are physicians, and they are, we all have the common decision.
Yeah, and these hearing aids, the special hearing aid, what you're talking, especially the cross, I mean, it ranges from, like $2,000 to $6,000. It depends what technology you want. You want a higher technology that cut down the background noises, or you want a lower technology that you don't care about it. You want to watch TV, or you want to watch, listen to the music in the iPad. It all depends on what technology you want.
Okay, I appreciate that. Like I said, a lot of this whole seminar for me had been very beneficial. And I made it a point that I don't miss it today, no matter what, and and I'm very thankful that, this is being done.
In the chat line, I had given this cell phone, office number of Dr. Dhar,
Okay,
625. The first one is a fax, but the 777 is their office number.
okay, thank you so much.
So, I'm sure there are a few other questions or personal problems you have. If you want to share, then you go ahead and unmute yourself. What are the common misconceptions our Indian community has? And I'm sure to some extent the local community. People still are not aware of a specialist audiologist. And there are very few actually audiologists. There are a lot of other centers, they claim that they're usually technicians. They're not qualified audiologists. There's a lot of difference between a technician and audiologist. I'll tell you from my personal experience, 6 years ago, in a very sort of recognized institution, Vanderbilt, I saw a technician, and she was really not up to the par. They don't have a proper room for checking out the hearing. So, Chandrashekar, do you have any last word?
No, just, wanted to, encourage everybody, thank you for organizing this, bringing more awareness. And, because the hearing loss is a double-edged sword. It is a preventable disease. It can be prevented. It can be, remediated, but also once the damage is done, it can be permanent. At this point, we don't have any permanent cure. So highly encourage everybody, please don't ignore it. And if anybody in your audience, or if you know anybody who is a veteran, please, encourage them to get in touch with the VA, nearest VA. They get one of the best hearing aids possible, and all the services are available. Because again, not knowing the audience, I just need to say that the VA does provide top of the line hearing aids almost at no cost to the veterans. So if anybody is a veteran, please, I encourage them to contact the VA and get themselves tested. But otherwise, get an annual, like Dr. Dar was saying, like we get our annual exam, eye exam, please make it a point to get annual hearing exam. Because so earlier we identify, better the remediations can be, and we can prevent the damage from getting worse.
Shashi, your last word.
Yeah, Dr. Pramod, I wanted to mention here. So some patients, I'll tell you, there are some patients who are retired. They are on a pension. They can't afford all these expensive hearing aids. So the very common question, I can't spend money, $3,000-4,000. Okay, so one is they can go through insurance. Some insurance do cover. And also, if they don't have much income, I have a source called Here Nashville. So if I refer a patient to Here Nashville, I can get them free hearing aid for them. They do have around $300 copay, but they do get $3,000-4,000 worth of hearing aid. So Here Nashville is another one, but they do expect audiologists to first examine, send the report, and the audiologist will fit the hearing aid, once, and they'll take care of the patient's need. Then this is only for patients who cannot afford the hearing aids.
I think there is something in that President Biden was thinking about offering hearing aid for Medicare patients. I don't know what quality of Medicare hearing aid.
No, unfortunately, the Medicare doesn't cover. So if you talk to our one of our billing coordinator, she says, well, don't go for Advantage plan, she says. but it's a double-edged sword, kind of thing. Like if you have Advantage plan, it's good. They do cover glasses and hearing aid. But unfortunately, when you go out of state, that doctor may not be credentialized to see you, or if you have a health problem. So everybody takes Medicare. Almost everybody in America takes Medicare. So stick on to the red, white, blue card, but have a 20% co, for 20% coverage with a supplemental insurance plan. I think that's the way to go. As far as I'm not a specialist on insurance analysis or anything, but Medicare doesn't cover hearing aids at this point, and they are trying to propose, but I don't know because it involves a lot of cost. So, but it's better to have some health savings account deposited, or maybe even care credit also can be used to pay for hearing aid. There are varieties, or contact some voluntary agencies. They can help in covering hearing aids if they cannot afford. So, there are varieties way to get the hearing aids.
Also, the other thing is, some of the states, Dr. Pramod, the Medicaid does cover the hearing aids. So because there are audience from all different states, they may need to explore that option also. There's a possibility. Some states do that. The Medicaid program covers hearing aids.
Mhm.
And answering your question about President Biden, there is a bill in the House and in the Congress right now. The proposal has been there, so it's not been voted yet. But we're hoping that next time, it's going to come to the floor.
But just to clarify some of the things, a lot of you know about Medicare. Dr. Dar mentioned Medicare Advantage Plan. There is Medicare C plan. And some of them, there are so many providers for Medicare Advantage Plan that is offered by the private company. And some of them, like Blue Advantage, I think, is covering the Medicare hearing aid. But the traditional Medicare, where we call it traditional Medicare, run by the federal government, you have to have a supplemental policies. And again, there are 10, 15 companies offer supplemental policy. Or that is also called a Medigap. That is not covered, they don't cover hearing aids. So just to clarify that. And let's hope President Biden's bill passes through. And I'm sure that pricing of the hearing aids will drop. Once there's a mass, more number of people using the hearing aid, they will drop by thousands of dollars. So let's hope that goes through. Any other last question? We had an excellent presentation by Dr. Chadrashekar and excellent comments by Dr. Shashidhar, and give them a good hand. Excellent. And I think there were a lot of good questions and personal experiences. This program is recorded on the Zoom, and I have put our website, icSSS.org. Let me see what happened. Okay, please see our website on the chat line, icSSS.org, and you can. The recording will be available tomorrow. If you're in a rush to get it, send me an email and I'll forward that. Otherwise, if you wait for about 4 or 5 days, we'll have this on our website, this recording. Again, thanks to Dr. Chandrashekar and Dr. Shashidhar. And I'll end this meeting right now.
Yes, it's our privilege. Thank you.
Thank you. Yeah.
Bye.
Thank you.
Thanks.